Hey folks, 24.2 to 24.4. That's what we're doing here. All right, this is we don't do much of this in lab, and to be honest, I'm not gonna be concerned too much with teeth, but I'll just go through and show you some. Some of you might be pre-dental for all I know, so we'll talk a little bit about it. So first of all, what's the function of the oral cavity? The oral cavity has the tongue and the teeth in it, and that's where the salivary glands dump their saliva. So Uh, we have sensory analysis of the food, and by the way, that's part of what causes the salivary glands to secrete. There's sensory analysis, and then there's a reflex that causes salivary glands to be secreted. And then we have the tongue moves the food around, and the teeth grind it up. So that's what you have there. The mucus and saliva from the salivary glands are mixed with your food, and they keep it moist and lubricated as it's swallowed. And by the way, there also is some. Well, that's the next one. There, right, number four. There's limited digestion. There is salivary amylase and salivary lipase. There's probably the amylase is more important, but this is limited because it only lasts as long as until you swallow the food. And of course, you don't keep the food in your mouth that long because as soon as you swallow the food and it hits the stomach acids, the salivary amylase and salivary lipase is inactivated by the acids. But while it's in your mouth, some of the carbohydrates are broken down by amylase and some of the lipids are broken down by lipase. So this does indeed occur while you're chewing your food. We do have some chemical digestion going on there. And of course, we have lots of mechanical digestion going on. So that's the oral cavity. This is a picture of the oral cavity. We do this in lab. We do this, uh, all of this in lab, so I'm not going to spend too much time on it. I will point something out here. You have a couple frenula here, and here's your lingual frenulum right here. Here's your labial frenulum right here. So your lingual frenulum. Why am I pointing that out? Because some people have a pronounced lingual frenulum, and when they do, if that lingual frenulum is very pronounced, they are said to be tongue-tied because they can't move their tongue very much because they have their lingual frenulum is too pronounced. You can snip that. You can you can snip the frenulum and fix being tongue-tied. And in fact, some cultures snip the lingual frenulum at birth anyway because it assists them in it assists them in uh, making certain sounds in their language. So there's the lingual frenulum right there. And you can see the lingual frenulum again. Here's something pretty cool. I'll tell you that these openings of the submandibular ducts is important. Because of those openings right there, you'll have salivary amylase breaking down any starch or amylose or amylopectin or glycogen or anything, depending on what you're eating, of course. The saliva comes out right there. And then you'll have a buildup of some of your disaccharides and monosaccharides because your amylase is digesting that starch. And because of that, you can have tartar buildup in the back of your lower teeth right there, your lower incisors. Uh, why? Because the amylase is digesting the starch or amylose or amylopectin, giving you sugars that the bacteria can burn, and they'll make a biofilm on the back of those two little teeth right there. And that's why the dentist goes in there and scrapes the back of those teeth, talks about the tartar on the back of those teeth. So that's important. That's kind of important for the dental field. The rest of this stuff is really lab stuff. Here's your salivary glands. Parotid, submandibular, sublingual. We'll learn those in lab. All right. Let me see what else. Nothing else there. That's just your salivary glands that we'll identify in lab this week. All right. Control of salivary secretions. Well, these are the salivatory nuclei. Please do not confuse it with solitary nuclei. Don't confuse it with this. All right, because that's not the salivatory control. what happens is the salivary glands are controlled by cranial nerves 7 and 9, and you probably already know this. You probably remember this from previous lectures where we've talked about the cranial nerves. And these 7 and 9 go through these salivatory nuclei, and you can see where these are right here, and right here. And so this is where the control of salivary secretions come from, and it's a reflex. When you have sensory input from food hitting your mouth, or sometimes even the thought of food from your cerebral cortex, it'll run down through these salivatory nuclei, and it'll run on cranial nerves 9 glossopharyngeal and 7 facial, and hit your salivary glands, and they'll secrete their products. So you can see the control right there in the brainstem. All right. This is a tooth. Enamel is one of the hardest materials in our body. It's very hard. That's enamel. This is dentin. This is yellow. If you've seen people with yellow teeth, it's not necessarily plaque or tartar or whatever you want to call it. It's not necessarily that. It really could be just thin dentin, or thin enamel. I'm sorry, thin enamel, and the dentin is showing through. That could be what that is. Otherwise, I'll show you the deciduous teeth and the permanent teeth, and we're not going to talk a lot about teeth here. When you take microbiology, if you haven't already, you'll talk about bacteria that are here down in your gingiva and that cause what we call gingivitis. We'll talk a lot about some of those bacteria in microbiology. Here are some of your teeth. You have your incisors, your canines, which are also called your cuspids, and then your bicuspids and molars. And sometimes your bicuspids are called premolars. These are deciduous teeth. These are your baby teeth or your milk teeth. So some people call these baby teeth. Some people call these milk teeth. Some people science calls these deciduous teeth because like a deciduous tree that drops its leaves, you drop these teeth until you get your permanent teeth. So you can see these. And you can see the incisors and the cuspids in your molars there. All right. And these are your permanent teeth. Okay, so with your permanent teeth, I guess these third molars are the only thing I want to talk about. These are called your wisdom teeth. Sometimes they don't come through. Sometimes when they don't come through, sometimes they have to be removed because they start to come through but get impacted and create problems. Sometimes they come through just fine and you never have to get them removed. But these wisdom teeth at times can cause problems. You have to have them surgically removed. So you can see your incisors. That's your central incisors, by the way, one on each side. By the way, we usually look at this. Let me stop this and start again. When you name these, you're usually looking at one half of either the top or the bottom, like that. That's what you're usually looking at. So you have your incisor right here, central incisor. You have your lateral incisor. You have your cuspid right here. You have your premolar right here. Should have 2 premolars. Let me see. Yeah, your second premolar. And then you have your 2 molars. And then you have your wisdom tooth. And then you have a mirror image on the other side. Central incisor, lateral incisor, cuspid. First premolar, second premolar, first molar, second molar, wisdom. And then you have the same thing on the top. Well, actually, I just did the top. How do I know? It says maxillary. And then you have the same thing on the bottom, mandibular. So you usually just look at one half of either the top or the bottom and you name them. Central incisor, lateral incisor, cuspid, 2 premolars, 2 molars, and a wisdom. You can see that is different from your deciduous teeth. You have more permanent teeth than you do deciduous teeth. All right. And then your pharynx. You have these muscles right here that are involved in deglutition. This means swallowing. Okay, so this is deglutition, and your muscles involved in deglutition are these pharyngeal whoops, didn't mean to cross through it. These pharyngeal constrictor muscles. So superior pharyngeal constrictor, middle pharyngeal constrictor, and inferior pharyngeal constrictor. These muscles right here are involved in swallowing. They're going to help you swallow. We'll talk about the steps of deglutition here shortly. So that's the pharynx. And by the way, when you move the food from your tongue to your pharynx, that's a voluntary action. But then reflex actions take over. Now that doesn't mean that these pharyngeal constrictors are smooth muscles. They're not. They're skeletal muscles. But even as you know, skeletal muscles can have reflexes, like when you tap your knee and your leg kicks out. So these are skeletal muscles, but there will be reflex actions that cause them to contract, and they are involved in the swallowing reflex. All right, the esophagus. The esophagus has four tunics, like I mentioned in the previous part, and that's the mucosa, submucosa, muscularis externa, and serosa. The serosa here is called the adventitia. That's another name for it, by the way, or you can actually call it the parietal peritoneum. Now, however, this is not the peritoneum because this is up in your thoracic cavity, but this is not pleura either. This is not the parietal pleura that lines your lungs. This truly is serosa or adventitia because it hasn't entered the abdominal pelvic cavity yet. But these four tunics are still there, and these muscularis externa layers are involved in swallowing. They're smooth muscles involved in swallowing. All right. Deglutition is swallowing. This is the word for swallowing. And there's, I think, probably 4 or 5 phases in swallowing, depending how your book divides it up. So first of all, we talk about the buccal phase. The buccal phase is the phase when the food is in your mouth. Your buccal or buccal cavity is your mouth. That's your oral cavity. That's another name for oral cavity. You can say buccal or buccal. So the buccal phase. This is when the food presses against your soft palate and pushes the soft palate up and occludes your nasopharynx and your nasal cavity. So your nasopharynx would be right here, and this soft palate occluded it. So now your tongue's pushing the bolus of the food back into your oral pharynx. When the food hits your oral pharynx, it actually starts to push the epiglottis down. What's going to happen is the epiglottis is going to be not in this phase right here, but it's going to start to happen in this phase. The epiglottis is going to move down. It's going to open up the laryngeal pharynx, but it's going to protect the larynx, your voice box, the opening of your trachea. So this is so the food can't go into your air passageway. So the buccal phase or buccal phase is when you push the bolus of food into your oral pharynx. Now this is the pharyngeal phase. The food is now in your pharynx. Now this is all reflexes at this point. You already did the voluntary thing by pushing the food back into your pharynx. At this point, and you probably realize this, if you ever started to swallow some food and you realize maybe you should have chewed it a little bit more, you probably, if you haven't pushed it too far back in your throat, you probably could contract some of those pharyngeal constrictors and get it back in your mouth and chew on it some more. But if it went too far, you're done. You can't get it back because now the reflexes take over, and the muscles, the pharyngeal constrictor muscles, push this bolus of food into your esophagus. So this is the pharyngeal phase. Then this is when the soft palate is completely occluding the nasal cavity, and the epiglottis is completely occluding the pharynx. I'm sorry, the larynx, the trachea. The esophageal phase is when the food enters your esophagus. The esophagus has no skeletal muscles around it. Well, I shouldn't say it like that because there are some skeletal muscles around the esophagus. Peristalsis in the esophagus is controlled by the smooth muscles of the muscularis externa, and the smooth muscles of the muscularis externa push this food down. You should know something about swallowing, and that is this. Dysphagia is difficulty swallowing. And what is this? These are homophones to each other. They're pronounced the same. That's what they are, homophones. So they're pronounced exactly the same. Dysphagia and dysphagia. Dysphagia with a G is difficulty swallowing. I'll talk about that in a second. What is this? This is difficulty speaking. So when a transcriptionist or a nurse or somebody or some healthcare worker is they're talking with the doctor or the PA or the nurse practitioner or whatever, they have to be careful that they both understand what they're talking about. Now, typically, if they both know the patient, they're going to know in context if the patient has difficulty speaking, spelled with an S, or difficulty swallowing, spelled with a G. But these sound the same. So if you're transcribing doctor's dictation from a taped disc or whatever they tape it on, iPads, iPhones, I something, iPad 10,000. When you're listening to some dictation and they say dysphagia, you kind of got to know it in context, and you got to know if they're talking about dysphagia spelled with a G or dysphagia spelled with an S. How do they diagnose dysphagia? Well, first of all, the patient knows if they have dysphagia, they have difficulty swallowing. But another thing is this: they can put a barium pill in here, or even liquid barium, and you stand by an x-ray machine and they watch this pill go down your esophagus. And if you have a constricture point or something that's causing this difficulty in swallowing, they'll see that pill stall someplace and not clear at the appropriate amount of time. Or maybe if it's a liquid, they'll watch the liquid go down your esophagus and they'll see if there's a constricture someplace. There's a disease that leads to these constrictures. It's called eosinophilic esophagitis. Yes, you know, eosinophils are white blood cells. Eosinophilic esophagitis, inflammation in your esophagus with a lot of eosinophils infiltrated in the area. This leads to constrictures and dysphagia. Dysphagia spelled with a G. And then this is when your bolus enters your stomach. Now at this point, the gastric phase of digestion starts. So we'll get to the phases of digestion. So the swallowing is done right here. I do want to talk about this sphincter muscle briefly. This is the lower esophageal sphincter, also called the cardiac sphincter. Also sometimes called the hiatal sphincter. And indeed, what a hiatal hernia is when the stomach pushes up through into here. Your stomach is actually up in the thoracic cavity, not below the diaphragm. So this is the cardiac sphincter. I spelled that wrong. Cardiac sphincter. It's also called the lower esophageal sphincter. This is not a true sphincter. This is not true. It is physiologically a sphincter, but it's not anatomically a sphincter. Anatomically, a sphincter muscle is a circular muscle. This is not an anatomical sphincter muscle. But physiologically it is. Physiologically, the circular muscle layer of the muscularis externa can close off. But that's the circular muscle layer of the muscularis externa. It's not a separate sphincter muscle that closes off this opening. So this is not a true anatomical sphincter, although it is a physiological sphincter muscle. So this is the collage of the buccal, pharyngeal, and esophageal phases of swallowing. That's the collage. Make sure you know them. They're on the test. And make sure you know swallowing is called deglutition.